Back for another conversation with our COVID-19 reporter, I guess what we'll call you, Chris Vanderveen, our director of reporting here, investigative reporter as well. The first question is always, how close is Colorado to a lockdown? You see places around the world saying we have no other choice. How close is Colorado?
Kyle, I'll put it this way. We're out of options here in the state of Colorado and most counties around the state. We've now entered the pretty please phase of this, where you're having counties, you're having state leaders saying, look, guys, you know what's coming if you don't start to do this at home. And they're finding that most of the spread is taking place inside small gatherings. So they're saying, really stop those small gatherings. If we go beyond the please phase, we all know what's coming next.
Is that the reason why Colorado is seeing such rapid spread, despite the fact that we've got a pretty good rate of mask wearing? Because people are wearing masks out and around, but then they're gathering in small places and not wearing masks?
I think there's this idea that we have that all of this spread is taking place in places that we can see with our own eyes, like restaurants and other businesses. And the reality is, from public health officials, is that most of the spread is actually taking place inside places you don't see. It's small gatherings inside homes where neighbors and families and other people who don't live together are getting together in small groups. And it's that rate of spread that's taking place inside those small groups that the state is now saying that is the primary concern, what we're seeing so much spread from right now.
We know with so many Coloradans now going into the hospital that there are people who have a pretty good idea that I got somebody that I care about or at least know sick. And that's a pretty weighty thing to deal with. But there's also the reality, Chris, that the way the virus works, there's a very good chance you could have a mild case, be totally asymptomatic, and have no idea who you get sick.
I had that exact conversation with Dr. Leon Kelly, who's the coroner down in El Paso County earlier today, and he said he's talking to people that were mildly symptomatic that now just get told that person that they were close to, and possibly because of their actions, are now in the hospital. And he describes those conversations as devastating for the person. Imagine your own family, imagine your own circle of friends, and you show up with a mild sore throat or a slight cough. You don't think it's that big of a deal, and yet you learn that potentially you were the reason why a loved one, a mother, a parent, a grandparent, a friend, ended up in a hospital. That's happening right now in the state of Colorado, because sometimes people believe that they're not sick enough to have COVID. Lots of people have mild symptoms. It doesn't mean that you can't spread the virus to somebody who's going to get a much worse case of it.
You mentioned El Paso County. The situation in their jail is something. I understand there's a certain portion of the population that says, well, if you don't want bad things to happen to you, don't ever get accused of a crime and have to wait in jail for your trial, because then whatever happens, happens. I can't really grapple with that degeneracy. But to folks who say, you know what, human life is worth protecting, the situation in the El Paso County jail is out of control, and it shows you the explosive power of this virus.
It's a real-life petri dish that's taking place inside the El Paso County jail. We had more than 900 inmates. A huge percentage of the total inmate population that came down with the virus. And it goes to show what happens when the virus gets in, and that exponential growth that can take place in an environment like that. And it becomes impossible to sort of limit the spread in some of the situations, because not only do you have inmates that are living close together, but you have a lot of people that are required to work inside the jail for laundry purposes, for food purposes, for just correctional purposes. Those people got sick as well. The good news, at least from the El Paso County standpoint, if there is some good news with such a huge number, is that the coroner down there feels like they're starting to turn the corner, and they're keeping inmates isolated. If you got sick, if you showed up positive, they keep you isolated for 10 days. And the thought is, if you haven't shown symptoms for 10 days, you're then free of the virus. They're starting to turn that corner. But wow, what an incredible story that's developed down there with so many inmates who got sick.
You know, Chris, I think everybody kind of pictures their own family, their own workplace, and I know that people appreciate it when we kind of talk frankly about the way things work in our families and our workplace. I mean, 9 News has so few people in this building compared to last year, and the stringent requirements around here for us to protect each other are really something to behold. Yet, I don't know, I'm just kind of assuming that somebody here is going to get sick. There's a good chance somebody in my family is going to get sick just due to the prevalence of the virus in the wider community.
There's so much virus swimming around right now. There's more virus swimming around right now in the city and county of Denver than there has ever been since the start of this. So your chances of becoming infected have gone way up. And if you have people coming into a building, now keep in mind, you talk about this newsroom that's behind me. Normally at this time of day, there'd be dozens of people, dozens and dozens of people behind me working actively. We've gotten rid of most of those people. Most of those people are working from home, just like any business around the state. But when you have some people come in, the chances of even 10 people coming in, which we have right now behind me, one of those 10 getting in is much higher now than it was 2 months ago. And even people that are taking great precautions, it's just simply, it's a vulnerable time for a lot of people.
I remember in the spring, one of the signs that things were getting real is when the governor got involved and pressured the ski resorts to shut down. There's still a thought that we're going to have some semblance of a ski season. People are going to be traveling in from outside Colorado. I mean, what are the chances that we look back in a month and say, well, that was kind of nutty?
It may be the same way that we looked at when we tried to open schools again at the early beginning of this semester, and then realized, boy, that's just really logistically difficult to do. I know that the ski areas have great plans in place that they've worked very, very hard on with the state to get going and to move efficiently. Logistically, it becomes different when people start to show up. So we're still in November. We're not talking about huge crowds right now. A lot of ski areas aren't even open yet. But when we start to move past Thanksgiving and closer to December, logistically, this is going to be more and more difficult to do it. It's one thing, as schools know this very well, it's one thing to open up on paper. It's a completely different thing to open up in reality. Schools, Denver public schools, for example, lots of school systems are realizing just how difficult it is to stay open after you went through all this work to stay open. I think ski areas are going to realize the same thing. I wish nothing but the best of luck for them. They're a huge part of this state. But how they do it on a day-to-day basis is going to be challenging. And if we start to see the numbers continue to go up from where they are right now, boy, it's going to be darn well near impossible.
And in fairness, I understand this is shoulder season, but like in Summit County, they've said that the issue is not outsiders, it's locals that have been contributing to the spread in Summit County. Lastly, Chris, I just want to reinforce for people that there's going to come a point, it would certainly appear fairly soon, in which Denver, other places in Colorado, look around and go, oh goodness, what do we have here? We must stop this at all costs, which is likely to be a shutdown. That does not stem the issue right then. It harkens back, in my mind, as a history buff, to the days of like sea travel, where it took weeks for messages to pass back and forth, where if something happened, you wouldn't be able to do something about it until weeks beyond there. That's the situation with the virus.
We talk a lot about the lag, and that is a word that you hear over and over again when we talk about the virus. Think about it this way. If I get sick right now, if I get the virus right now, I may not show symptoms for 4 or 5 days, and maybe I have mild symptoms, and I'm around somebody who then gets infected by me 4 or 5 days from there, and then after that, you start doing the math and adding up all those days. It takes time for a lot of this to get going. And on the reverse side, it's the same thing when you start to do things to try to cut it off. It doesn't happen instantaneously. So you would expect cases to start to drop at some point, and then 2 weeks after that, you would expect hospitalizations to start to level off, and then 2 to 4 weeks after that, you would expect deaths to start to drop off. So it takes a lot of time to see the results of your efforts. And that's why there's patience. It needs to be involved. You have to be patient in all this, but you have to sort of be realistic in all this, that it's going to take time to see the net result.
And man, spare a thought or a prayer for our healthcare workers who are just being worked to the limit right now, and they know better than everybody. There is no end in sight for them.
Kyle, they're the key right now, is that when you start to see them, in many cases, they're starting to be overwhelmed right now, but when you start to hear their complaints more publicly, when you start to hear them coming out and being more vocal about their concerns, that's when I think this could potentially turn, and there's going to be more pressure on the mayors and the county health officials to do something that they don't want to do right now. If you hear it from the healthcare industry, it's going to follow with the public health.
All right, Chris Vanderveen, appreciate your perspective as always.
You bet.